morning, all. I'm State Representative Kim Schofield. I'm a big believer in transparency. It's the cornerstone of my time here in the General Assembly. Weekly, I'll be coming to you all via YouTube to give y'all a recap of the week. First off, I hope everyone had a great Valentine's Day. Valentine's Day is not a one-day event, but it's a continuation of the love that is shared every single day. I love serving residents of District 60, which includes Southeast Atlanta, East Point, Forest Park, and College Park, and Hapeville. I would like to give a huge shout out and extend a huge thank you to the Clayton County Board of Commissioners, especially Commissioner Sonar Gregory, for passing the Crown Act, an ordinance that makes it illegal for county businesses, housing providers, and others in public accommodations to discriminate based on our cultural hair textures and hairstyles. This move is part of a national push to address an issue that we as people of color face when it comes to our natural hair, including our braids, our twists, knots, locks. We simply don't fit in with traditional hair standards, but we're about to change that. Also this week, I co-sponsored House Resolution 78, authored by Representative Sandra Scott, which would declare racism a public health crisis. A public health crisis affects humans in one or more geographic areas from a particular locality. Health crises have significant impacts on community health, loss of life, and the economy. Racism in America has done the exact same thing. Next, House Bill 377, the Georgia Women's Act. This Georgia Women's CARES Act will eliminate the liability of COVID-19 exposure to unborn babies and putting pregnant women at risk for the coronavirus, as well as allow compliance with the CDC, Georgia Department of Health, and NCCHC guidelines, COVID-19 precautions for pregnant women and babies. Listen, Georgia is currently facing a crisis within the state budget that spends astronomically high dollars throughout the 159 counties for the Georgia Department of Corrections when we talk about medical care, child care, transporting pregnant incarcerated women. The Women's Care Act would eliminate the cost for housing, prenatal and nutritional care, high-risk pregnancies, child care, child placement, transportation costs to hospitals, pregnancy doctor visits, staff required to be at the hospital, and all kinds of programming, saving the state money. House Bill 377 will also require additional costs for PPE, and we'll make sure that gets in the budget. It actually contributes back to the state's budget. So despite last year we passed House Bill 345 into law in October 2019, many penal institutions throughout the 159 counties still continue to break the law by shackling pregnant women and placing them in solitary confinement. In addition to the liability of not complying with the Georgia laws of shackling and solidarity confinement, the Women's Care Act, House Bill 377, will also eliminate the liability of penal institution not able to provide adequate prenatal care to pregnant women and high-risk pregnancies, resulting in women delivering babies alone in their cell, life-threatening infections, non-consented procedures, routine inductions, and maternal infant mortality, as well as pregnant women contracting COVID-19. Speaking of COVID-19, COVID is still running rampant and spreading like wildfire. Please protect yourself. Stay inside, social distance when you can. Practice washing your hands, hand hygiene, and wash your mask. If you have any concerns or would like to bring anything to my attention, listen, my constituents always come first. Please don't hesitate to email me at kim.schofield@house.ga.gov.